good morning. I hope you're joining us today on Apollo 24/7's Health Hour. In today's episode, we're going to talk about vaccinations for children, how these vaccinations or the immunization protocol helps our children from various diseases. What are the myths and doubts surrounding vaccinations? Do you have any queries? Go ahead and join us in the live session where Apollo's expert neonatologist and pediatrician, Dr. Shyamala, is going to answer your questions in the live session. So see you there, 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to yet another interesting episode of Apollo 24/7's Health Hour. Health Hour is a show which brings you experts from Apollo hospitals every week to your Sunday mornings, where you can ask your questions and queries in the live session. Today's episode, we are talking about immunization for kids and teens. Any question about vaccinations that you have for your children, for your babies, for your teens, right from COVID vaccinations to pulse polio, we are willing to answer all these questions in the live session. Joining us shortly on the show is Senior Consultant Paediatrician and Neonatologist Dr. Shyamala from Apollo Hospitals, Chennai. She's going to answer the questions in the live session. So what you do is, go ahead, type your query in the chat box. We shall take these questions up very shortly and we shall try and bring you an answer. And any question about vaccination is welcome today. Also, I urge you all to download Apollo 24/7. This is an app which brings entire Apollo hospitals to your hand and which brings you more power, more facilities and more discounts, more offers that you can use on. And if you have Apollo 24/7, you will be able to answer a few questions on the health quiz. On today's show, we also have a health quiz where you can win gift vouchers from Apollo 24/7. Chalo, let's start today's show. We'll start today's show by talking about this wonderful initiative called SACHI, which is Saving a Child's Health Initiative by Apollo 24/7 in association with Apollo 24/7. This is a mission to make quality healthcare accessible to underprivileged children at no cost. More than 10 plus pediatric specialties, renowned Apollo pediatricians are joining in this wonderful mission to give the best of the best pediatric consultations for children who require below the poverty line or underprivileged children for free. So go ahead, you know somebody who requires this kind of consultation or help, Scan the QR code to know more and share the link with those people. So it's a wonderful initiative. Make use of this and spread the good word. Also, as we are all recovering or we are dealing with COVID pandemic yet, COVID, अगर किसी को लगा है या you are recovering from COVID, there are still long-term issues which might follow. So understand what has COVID done to you and who requires additional support post-COVID recovery. Here's a simple AI-driven tool which is developed by the Apollo experts. Here's the COVID-19 post-recovery self-checkup. Click the link in the chat. It's a free assessment. It takes more than a little less than 5 minutes to do the assessment. The assessment will tell you if you need more help or if you require to meet a specialist, who do you need to consult. All of those will be given. It's a very important tool. Go ahead, click the link in the chat. It's a post-COVID-19 recovery self-checkup. Also, if you know somebody who's recovered from COVID, please suggest them that they can use this and understand what their health is right now at. So let's talk about vaccinations today. Let's talk about immunization schedules for our kids and teens. Joining us now is Senior Consultant Paediatrician and Neonatologist from Apollo Children's Hospitals, Chennai, Dr. Shyamala J, who has more than 26 years of experience in pediatric practice, special interest in pediatric infections, newborn care, and growth disorders. She is an honorary associate at University of Sydney, member of editorial board, Indian Journal of Practical Pediatrics, and she has contributed chapters to textbooks and articles in Indian pediatric journals as well. It's a pleasure and honor to have Dr. Shyamala on the show. Namaste, ma'am. Welcome to the show.
Namaste, Jansi. Thank you for Apollo 7 and Jansi for having me here this morning. I hope we clear doubts on immunization and parents can feel more confident about vaccinating their child.
Wonderful, ma'am. And what more is a best day to have you here on the Pulse Polio Day? The entire country is now going through a program, the Pulse Polio vaccination. So here we are on a Pulse Polio Sunday, talking about polio and the vaccination. Can you please give us a brief on the Pulse Polio program that is going on in India and how long has it been and who needs to get this done?
Yes, Jansi, now it's a wonderful initiative by the Indian government, the Pulse Polio vaccination. It's held normally around January, February every year. And there's a gap of 4 to 6 weeks between 2 doses of oral polio. We recommend that for all children less than 5 years, irrespective of your vaccination status. So we've had many calls and messages since morning saying my baby is already vaccinated. Should I go for this? Should I go for that? Can I have it in government hospitals? Should I only come to private hospitals? It's safe to have it anywhere. But the important thing is please have it. So irrespective of your child's vaccination status, this is our effort to get the entire child population in the country have a high level of herd immunity to polio. So it not only protects your child, it protects every other child in the country. Take it like that, and please go ahead and have it. And if you have any neighbors who have any doubts, please encourage them to go out. It does not matter whether it's a private setup or a government setup.
So actually, we also see a lot of Pulse Polio campaigning, advertisement, autos and rickshaws and mobile Pulse Polio vehicles as well. It's a huge campaign so that none of the child in the country misses this campaign. But yet there are certain myths. Though this program has been here for so long, there are still myths. Last time मैंने लगवाया था, I've got my child oral polio drops a few years ago or 2 years ago, और 2 बार लग गए, 4 बार लग गए. They have these doubts of getting the vaccine done again. So do you think that even though that they have done the polio drops, they should continue the polio drops till 5 years?
Yes, exactly, Jansi. So irrespective of your vaccination status and starting from birth to the age of 5 years. So usually it's twice a year and you should have it till your child crosses the age of 5. After that, he or she does not require it.
So even if you've got it, you still have to continue and continue till the child reaches 5 years. How many, and what's the booster for this, ma'am? Agar January mein somebody's got a booster, the original oral polio drops, when do they have to get the second booster?
See, the second dose of pulse polio is usually 6 weeks later. For people's convenience, both of these doses happen on a Sunday, so that you can go out and have it any time of the day. It's usually scheduled between 9 a.m. and 4 p.m. And just in case you missed that Sunday, it usually happens on the next 2 days as well. And the importance is to give it in these 2 or 3 days so that the benefit is maximum for all kids under 5 in the country.
Yeah, yeah. And ma'am, earlier, while I was a child, we used to have children with polio who were our peers or classmates. It used to be one common sight earlier. Now that I see that children are quite healthy and hale, has India achieved the mark in eradicating polio, or are we still behind the mark?
No, it's actually a wonderful landmark, Jansi. I think from the year of 2012, the WHO has declared India to be polio free. So, and we
Wonderful.
intend keeping it that way.
That's great. It's great. And I think contribution of the government, of the health sector, and the people's participation has been wonderful in this campaign, ma'am.
Yes,
And
yes,
let's
absolutely.
also, there are a few questions around the polio drops. Ki, थोड़े अफवाहें होते हैं, there are certain myths that the drops will give fever. Do they give fever like other vaccinations?
There are no side effects of oral polio vaccine. Only thing is, if your child happens to have diarrhea when you're instilling oral polio, then you might not have a full benefit from that. But the advantage is not only oral polio, practically every child in the country is also beginning to get injectable polio, whether it's in the private sector or in the public sector. So the oral polio is just, shall we say, it's just boosting the effect of what you already got. So children are doubly protected.
So, do you say that the injectable polio vaccine is much better than the oral polio vaccine? And who needs to get that?
The injectable polio is the next generation polio vaccine. So oral polio is cheap and it's easy to give the masses. So that's why these the mass vaccination programs usually have been relying on oral polio. But the next step is where the Western countries have reached, like let's say in the UK, Australia, and all. Nobody gives oral polio because they are already polio free for many years, and they can afford to give injectable polio to all their children. So I have to say that the injectable polio is not affordable for everyone. So, but the government hospitals have also started giving an abbreviated version of the injectable polio so that all children receive the benefit. So, in a few years, if we continue our polio free status, hopefully the oral polio drops will also stop. So, but till then, it's very important that everybody cooperates to get the pulse polio vaccine for their kids.
Great, great. So, understanding that Pulse Polio is a campaign which has got a lot of advertisement. Kahin na kahin, people must have heard of this one time at least in their lifetime, and they know what Pulse Polio and a Polio Sunday is. But our country, is it still lacking behind the primary awareness of good vaccination schedule? The regular vaccines that are promoted or we have as a protocol, are we behind in awareness of other vaccinations?
I think generally awareness of vaccinations for children is very high in our country. And when we see patients from, say, neighboring countries like Bangladesh, we see that their immunization status or awareness isn't as high, and people's receptiveness is also increasing. So I would say our vaccination status is improving every year. But there is
Wonderful.
always, a small group of anti-vaxxers who think that my baby can manage without vaccines. We go all out to try and convince these parents also, because that's the big barrier. Sometimes it's a tragedy to see that a totally preventable infection like tetanus. Occasionally, it's very rare, but it does happen. So we want to see that every child is protected against common infections. So we do encourage, universal immunization, and I would say I think India is doing very well as a country.
Great, ma'am. So, anti-vaccine campaigners, as we call them, anti-vaxxers, they must be having certain doubts. Also, as a parent, the immunization schedule seems very, too many thing and overwhelming for a parent. What are the common myths that you come across in your practice, ma'am?
See, they feel that if I receive an injection, they feel that I might get that illness. or they
Huh.
feel that the cost is not worth, I don't see any infections around me, so what am I actually trying to prevent? Or they say, my grandma says or my grandpa says that this might cause some health issues. So I mean, if people are in sync with the times, mostly they don't have any doubts. But it's not see, no vaccine is 100%. So I'm not saying if you get let's say even COVID, so though people are wanting to have the COVID vaccine, it's not as if 100% don't get. But the good thing is, when the people get the disease, it's in an attenuated form, and the severity is nowhere near the actual illness. So I think it's well worth having a vaccine, and side effects are very minimal. Most vaccines have been around. I would say COVID-19 vaccine is the newest kid on the block. Every other vaccine has been time tested and has actually taken much more years to reach the public.
Correct.
So I don't think we've seen any major side effects with the commonly recommended pediatric vaccines.
Yes, and also this myth that I keep hearing again and again, that babies and natural immunity will be affected if you give vaccination. So it's not good to give them vaccination. This is one common thing that I keep hearing. What do you have to say against it?
See, I think the baby's immunity, especially at birth, is derived from the mother. So, whatever the mother is immune, usually that covers the baby at least for the first few weeks, especially for diphtheria, tetanus, and whooping cough. So, the child is not vaccinated at birth for these three conditions. It's only happening at 6 weeks because the mother's immunity protects them. I don't think the child's own immunity would last beyond 6 months. So they are prone to all infections. So I wouldn't, I think that's a myth and that is best avoided.
Correct. So, and also the vaccinations are not just for newborn or young children. The schedule continues till the age that they come to adulthood or pre-adulthood. And most of the people, as they're aware and they're in a regular protocol of visiting pediatricians and for vaccination, they're fine. But after 10th year, people take vaccines slightly at a lesser seriousness. What are the vaccines that children after 10 or after 11 require?
See, most vaccinations, I think the frequency of vaccinations actually comes down after the age of 5. From 5 to 10, I think there are not many vaccines unless, new vaccines like COVID come into play. So we ask them to have a diphtheria, tetanus, and whooping cough booster at the age of 10, and again repeat this at the age of 15. Now I have some patients going to the US. The US the immigration form would ask them to get vaccinated against brain fever. Meningococcal vaccines we say, and also they ask them to update against diphtheria, tetanus, and whooping cough. So these are important. And for teenage girls, we ask them to have a human papilloma virus vaccine, which protects against cervical cancer. So people
Yes,
are
ma'am.
not generally aware of these. So I think they are good vaccines to take. In fact, I have patients going to the US who will just come to get a sign on the form. Is the US vaccine requirement? Can you just sign on the form? I said no. It's think of it as an investment for your child. You don't want your child to go to a foreign country and fall sick from a totally preventable illness. So I do emphasize
Correct.
that even children update their vaccination status in consultation with their pediatrician, or if they feel bashful to see a pediatrician, they can see their adult physician as well.
All right. So is that kind of what do you call hesitation to visit a pediatrician after certain age is still persistent? Is it there
Yeah,
in
actually,
reality?
a very funny situation. Some of the my patients who stayed with me from the age, from their newborn period, they are almost going to the US. Let's say at 16 or 17 years, my secretary
Correct.
comes and tells me, "Doctor, only the fathers come. The child is not come." And then, very embarrassed, he say, I'm the patient."
Yeah.
So
Literally.
yeah, so some kids are a bit bashful to be seen with a lot of little kids in the clinic, but I think if they trust their pediatrician, they don't mind.
Yes, ma'am. Yes, and as you were mentioning about HPV, now there were a lot of debates and a lot of issues around HPV. And HPV, as you said, protects from cervical cancer, one variant at least of cervical cancer that can be prevented with a vaccine. Can you please give me some more information about what age group girls should be getting it done, and if somebody has missed it in that age group, till how long a girl can get a HPV vaccine?
So generally, when we tell parents that this is for cervical cancer, they look incredulous and say, she's just 10 years old. Why does she need it? So I would say there are two reasons for this. One is that generally when kids cross the age of 10, the number of visits to the pediatrician become less, and so they end up missing these vaccines altogether. The second reason is that it's best given to children before they become sexually active. So I think 10 to 15 years is a good time to start it off, because then you can forget. The age limit is up to 26 years. So if you missed it, you can have it up to the age of 26. But this is the age when people don't think about vaccination. So I think that's why we prefer to catch them young and finish it off when they are about 10 to 15 years.
Now that COVID has come into play, we have a different opinion on vaccinations. At least now that we know what the value of a vaccination is. So, HPV, does it require a booster as well, ma'am, or is it a single dose vaccine or an annual vaccine?
So
What is it like?
no, I would, if they start early, around 10 to 11 years, before the age of 14 years, you need only two vaccines at the age of, at an interval of 6 months. Past the age of 15, you need three doses, 0, 2, and 6 months. So there's no booster as of now.
There's no booster. All right, ma'am. And the schedules of vaccinations are determined by our government of India. The health, we have a schedule. But the schedules which are in the private hospitals, there are more available vaccinations. What's the difference between these two?
I think the primary difference is in starting at least in the first year of life, it's the way injectable polio is given. In private hospitals, all kids receive the full dose of injectable polio at 6, 10, and 14 weeks. Whereas in government hospitals, because again, cost is an issue, so they give only zero point 0.1 ml versus the 0.5 ml, and it's given intradermally, that is under the skin, rather than as an intramuscular injection. This is for cost issues. So other than that, in government hospitals, they don't give influenza vaccines. They also don't give pneumonia vaccines, which are available in the private sector, and optional vaccines like the human papilloma virus or the cervical cancer vaccine is not given in government hospitals. But otherwise, I would say the government of India is doing a very good job in giving most, mandatory vaccines for children available. So I think they get a good deal. Patients get a good deal as long as they keep up their vaccination visits to the hospital.
Wonderful, ma'am. Let's talk about the COVID vaccination update for children. Where are we as adults? We all have received one or two shots by now. What is the status on children, and what do you have to talk about this?
I think intuitively parents don't hesitate when they have to vaccinate their children, because within about 2 to 4 weeks of announcing vaccination for COVID for teenagers, 15 to 18 years, about 2 crore children ended up getting the first dose. And our total 15 to 18-year population is about 10 crore. Just to give you an idea, about 1/5 of the population got themselves vaccinated within 2 to 3 weeks of announcement of the vaccine. And I think the drive is going pretty good. They're all waiting to go to schools because they're all stuck up at home for 2 years. And if parents can give them an iota of protection before sending them off to school, they're just waiting for the opportunity.
Great. So this, we are talking about the government approved 15 to 18-year-old. Where are we for the kids below 15 years, and what are the developments for COVID vaccination there?
I think probably the government wants to finish off the 15 to 18-year age group and then start looking at the younger age groups, because everyone's raring to go to school. I think surely that must be the next, landmark.
Yeah. And what are the vaccinations available for children in COVID scenario, ma'am, for COVID? What are the available
So
vaccines?
the government of India is recommending co-vaccine only for children as of now for the 15 to 18-year age group. So we advise 2 doses at 1 month interval.
In 1
And of
month
course, the
interval.
new vaccine, yeah, that's right. The Sputnik vaccine is coming up, but it's not yet widely available. So Covaxin for children and Covishield or Covaxin for the adults.
Adults. And so the booster timing, because it is Covaxin, it is only 1 month, and less than 1 month they need to get the shot done.
That's it. Yeah.
Right. Ma'am, here I'm asking a few questions from our audience who have joined us live this morning. The first question
Okay.
is Ammutam. Is it necessary to put all vaccines that are suggested by the health ministry? Or can we choose the vaccines for children?
Well, I mean, you don't want to choose the infection which your child gets, because common infections are prevented by the vaccination suggested. See, the government of India has certain mandatory vaccinations. The IAP or the private body may be suggesting a little few extra ones, but at least the government of India schedule is mandatory. I think they're all very important vaccines. I would suggest please don't choose, please take them all.
Wonderful, ma'am. Wonderful. Because we cannot select our infections. That's a great word that you used. Because there's no choice there. You don't know what's coming up when. So if there is a protection for my child, I would rather buy and get the protection. When there is a free protocol given by the government, why not? Definitely. Thank
Yes.
you, ma'am. Next question is Vanangamudi Pandyan. Up to what age do polio drops to be taken for kids? You've answered this, but yet once again from the audience.
Most vaccines are up to the age of 5 years, but at 10 years, there is a booster for diphtheria, tetanus, and pertussis.
Ma'am, this is
And at
only for
15
polio
years,
drops. He was asking only about polio drops.
sorry, repeat your question, Jansi.
Up to what age do polio drops to be given for kids?
Okay, up to the age of 5 years.
That's it. All right. Oh, so as you said, continuously till the age of 5 years. And Suresh Moka's next question is: polio drops given a child regularly use drugs continues. All right. I understand the question this way, ma'am. This is Suresh's question. While giving polio drops, can a child continue using the drugs that are regularly used?
What kind of medicine? See, there's just one caveat here. The only situation where you shouldn't be giving oral polio drops to your child is if the child is on steroids for whatever indication, steroids or immunosuppressive medications for certain special illnesses. These children, we specifically counsel don't take your pulse polios, but this is a very select situation, and their doctor would be advising them about it. So anything that suppresses your immunity, immunosuppressive drugs or steroids. So these children shouldn't be getting oral polio. All else should get under the age of 5.
So anyway, a pediatrician would advise them in such situation. Their
I would
personal
say
pediatrician
that
would be.
they should not be taking any live vaccines, because oral polio is a live vaccine, so it should not be taken.
So otherwise, it is safe on most conditions and doesn't have most of the side effects.
Yeah, correct.
Yeah, done. Ma'am. Next question is from Shailaja Bhimavarapu. My baby vaccine hepatitis A first dose. Sorry, ma'am. The question is my baby's first hepatitis A vaccine. Can it be delayed by 1 month, 7 days? How many months gap should there be between the hepatitis A first dose and second dose?
Hepatitis A vaccine is given in 2 doses, 6 months apart. So all the guidelines are given. They would give you the ideal gap, but sometimes people end up missing or delaying a dose. But you have to give it or complete your vaccination at the earliest available opportunity. It doesn't mean it lapses. So if you've had one dose and at the 6th month you miss, so even if you come back at the 7th or 8th month, you should still get your vaccine.
So even if you have missed, that means do not panic and get it at the earliest possible
Earliest.
date.
Yeah, so catch-up
So
vaccination should be completed.
that's it. And Suveshi Sharma's next question is: what are the vaccines that should be given at the age of 3?
See, at 3, there is nothing that's scheduled, except if you've done all your age appropriate vaccines, you would have had your DPT, polio, whooping cough at 6, 10, and 14 months, and a booster of this at 1.5 years. And there would be an MMR vaccine at 9 months and 15 months. Pneumonia vaccines again 6, 10, 14 weeks and at 1.5 years. Maybe the chickenpox vaccine at 1.5 years. So if you've had all of these, Specifically, there is no vaccine for 3 years, but we do recommend a flu shot every year at just before the monsoon season. So in Chennai, it would probably be around June, July. So every year, have a flu shot. So
For the child,
specifically, there
every
is,
year.
yes, till the age
Every
of
year
5.
till what age? Till the age of 5.
Yeah,
Okay,
that's
ma'am.
right.
So that's till the age of 5. So if Suveshi's child is 3-year old, another 2 years she needs to continue flu vaccine. Ma'am, also one
Yes.
personal question here. I've heard that flu vaccine keeps changing every year. Is that true, and why is it so?
See, the virus is very intelligent. Like we know from the COVID virus, there are many genetic variations that keep happening. And what the WHO does, and there are some regional flu centers all over the world. These, so they collect the flu virus isolates from across the country, and they analyze what are the the types of virus, and based on what is the predominant virus the previous year, they release that this is the vaccine that should be based on for the next year. So they actually survey the variations that the virus undergoes every year, so that you will be reasonably protected about against the common serotypes that you're likely to be infected with.
Okay. Okay. Ma'am, there's one question about oral polio vaccine I was going through. The child is having fever today. Tyagarajan is asking this question. My kid is having temperature today. Can she take oral polio vaccine?
There is no problem. She can take.
She can. So even if they are under some kind of illness, they should continue.
Yeah, minor illness, no problem. If the child is
Sorry, ma'am?
obviously very sick, and if the child is not very sick, then it's reasonable to take the oral polio vaccine.
Ma'am, generally, after you get any vaccination, there's a fear of getting slightly body temperature rises and slightly feeling sick. Is it the same thing after oral polio vaccine as well, or oral polio does not have any side effect?
No, 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 no side effect with oral polio.
Nothing. So they can go ahead and get the vaccination done. All right. Aisha Nazia ji, आप पूछते हैं कि is this vaccine necessary for my 6-month-old baby? कौन से वैक्सीन के बारे में आप पूछ रहे हैं, जरा टाइप करके बता दीजिए so that I can ask the question to doctor. Aisha Nazia, you're asking, is this vaccine necessary for my 6-month-old baby? Which vaccine are you referring to? Please type and go ahead. Sarfaraz Ahmed ji, I think we've answered this question. Are all vaccines necessary for kids? Please mention the necessary vaccines for kids.
Okay,
Can
the
you
mandatory
reiterate?
vaccine. Yeah, sure. BCG at birth, hepatitis B, oral polio given at birth, and then at 6, 10, and 14 weeks, you'll get the diphtheria, pertussis, whooping cough, hepatitis B, and pneumonia vaccines. And of course, if you have the proviso, you can have the rotavirus vaccine as well. At 9 months, you'll have the MMR vaccine. At 12 months, hepatitis A vaccine, and repeated at 18 months. At 15 months, MMR vaccine. And at 18 months, a booster with diphtheria, pertussis, whooping cough, and at 5 years. And in between, flu vaccine every year.
Wonderful,
this
ma'am.
is in
Thank you so
short.
much. In short, and that's actually sums up all the vaccines together. Ma'am, Shailaja's earlier question, in continuation, we got another question. MMR between both doses, how much gap should be there?
At least I would say 2 to 3 months.
That is it. And if they go beyond it and for some reason that they have missed it?
Yeah, they would have a catch-up vaccine. In fact, I want to just reiterate the importance of the MMR vaccine. Measles can be a severe illness, and we've seen that any nations where there's war going or famine going or some kind of large-scale calamity, and they've missed out on essential vaccines, there have been outbreaks with major diseases, and one of them is measles. So never relax. Your measles schedule should be in our country at 9 months, at 15 months, and again at 5 years. And MMR is mumps, measles, and rubella. I want to just reiterate here the importance of the rubella vaccine. So, in a country like ours, which is upcoming and progressing on all indices, we should not be seeing a preventable condition like rubella. Rubella can be a very devastating disease in a newborn. Like they born with cataracts, difficulty in hearing, and they completely, their overall development is delayed, and they can't speak and they can't hear. We've even like 2 or 3 years back in the country of Tamil Nadu, and these are not poor people. They are in a good, reasonable, socioeconomic status. We are seeing occasional children with rubella. And how do you prevent against rubella? Ideally, every woman before she gets pregnant should check her vaccination status to rubella. And if she is not immune to rubella, they can have a standalone rubella vaccine before they plan pregnancy, because this can go a
Ma'am,
long way.
what if the mother doesn't have her vaccination record on hand, or she doesn't know if she's vaccinated against MMR?
See, then there are two things she can do. I'm hoping that she's not pregnant yet. So you can actually check your rubella immune status by doing a blood test. If that is not available, just give yourself the benefit of doubt and take a rubella shot. Sometimes what we do during drives, I think there was an MR vaccination drive by the government a couple of years back. So there is only measles and rubella. In colleges, I think girls in colleges were actually asked to take MR vaccine or even plain rubella vaccine. I think it's very important that any woman before planning a pregnancy should check her rubella vaccination status. If she's unsure, just have it anyway. It's very important.
So while we're talking about vaccinations for children, this means that vaccination for a pregnant woman to cover her child, unborn child, for certain diseases is also important. Can you please give me some information? What are the vaccinations a pregnant woman has to get?
So I did already mention that before pregnancy, she should have the rubella vaccine. During
Yes.
pregnancy, suppose she's not sure about her DPT vaccine status, that is diphtheria, pertussis, tetanus. She doesn't know if she's had, or she's unsure. Then she should have two DPT boosters. We call them Tdap shots in pregnancy
Okay.
after about 26 weeks. Okay, and flu shot after 26 weeks of pregnancy is very important, because the newborn child cannot get flu vaccines till the age of 6 months. So, flu shot given to the mother in pregnancy protects the newborn child. And
Okay.
of course, the new vaccine, I said, the COVID vaccination is extremely important and very safe if you give it in pregnancy. So, at least two shots in the last trimester of pregnancy. It's very important, because a happy event like childbirth, if it's clouded by mother having COVID, I think it takes away the joy from the entire situation. The last 2 years, we've seen so many mothers coming in with COVID. So she's kept apart, child kept apart, families, they're not there to share the happy event. So please
Yeah.
all to take COVID vaccination. It's very, very safe.
Yes, ma'am. Ma'am, Mohit Jain's next question. Which is the best varicella vaccine for chickenpox? Any brand or company that you would want to suggest?
See, I don't think I want to be talking about brands in a forum like this. There are only two brands available. Either is good.
All right, ma'am. So that's a, people are worried about, when you have choice of selecting something, like simple thing, Covaxin karu ya Covishield karu. Now that we all know that there are multiple brands, we get a little more cautious while picking up brands, is what I think.
Yeah, choices are not much with adult vaccines. We have only two or three, though there are many more in the pipeline and more controversies, or we will get to know more about side effects as the masses get vaccinated. So, but other brands, I do not want to endorse brands on this forum. I hope you understand.
Yes, ma'am, definitely. That's a good way to answer this too. Next is Ajay Goel's question. Ajay is asking, our daughter is 17 plus, but we're not having a track of her vaccinations. Whether at this age can we opt for vaccinations? If yes, please let us know which vaccinations we should go for her now.
See, at 17 years, if she's not traveling to the US, she should at least have an MR vaccine, Tdap, that is diphtheria, pertussis, tetanus vaccine, COVID vaccine if she's not already had one. If she doesn't have any underlying illnesses like asthma or something, a flu shot is not mandatory. So, but at least the first three would be good.
Yes, ma'am.
And the cervical,
Uh,
I hope I mentioned the HPV vaccine, the cervical cancer vaccine. I hope I
no, ma'am,
mentioned that.
not for this gentleman, but yes, 17-year-old child,
Yeah.
HPV
Yes.
definitely.
Yes, absolutely. 3 doses.
3 doses, 17 years.
Yes,
Yeah.
within a gap of 6 months.
All right. Ma'am, my daughter is 19 now. I could not give her the third dose of HPV, and she had to leave for the college. So, can I get her at a later stage as well, or do I just wait for it,
No, don't
her to
let it
come back?
lapse. So have it at the earliest available opportunity. A little bit of delay doesn't matter, but please complete your 3 dose schedule.
All right, ma'am. Thank you so much. Here's the next question. Trisha Kezia's question. Why are the immunization needles for babies as long as the ones that you've used for adults? Is there a difference in size, ma'am?
See, it all depends on the muscle mass. If the baby is particularly chubby, I mean, you would need the injection to go into the muscle. So if you use a short needle, it ends up leaking out, and you don't want to have that. There are subcutaneous vaccines which are given with much shorter needles, and BCG is a intradermal vaccine, so that's also given with a very short needle. So it depends on the muscle mass and the age.
All right. Rima Mahajan's question is the next one. Can we give polio drops at the age of 6?
No, not needed. So up to age of 5 only you need polio vaccines.
So the child is turned 6, they don't require to give the vaccine.
No, no.
Yeah. Now this is becoming extra cautious. Yeah. All right, ma'am. Soumya Prahlad's next question is, can we give water or any juice immediately after polio drops to child?
Try not to give anything for at least half an hour after the polio vaccine, oral
Okay.
polio vaccine.
Oral polio vaccine, try not giving anything after. Any particular reason, ma'am?
See, you don't want the virus to get inactivated, especially if you give hot fluids and all that. I told you that oral polio is a live vaccine. So, and also suppose a child throws up, then it becomes void.
So it's better to avoid any kind of food or liquid immediately after oral polio. And that is, you said, 30 minutes they have to wait.
Yeah, correct.
All right. Great. Ma'am, my daughter is 11-year-old and I want to give her the HPV vaccine. This is Shyam Sreshta's question.
Yes, absolutely. Please go ahead. At 11 years, she would need just 2 doses, 6 months apart. So 0 dose now, and 6 months later, the second dose.
So they don't need to wait. Ma'am, does anything with HPV has to do with the menstruation time or achieving menarche?
Not at all. So they say that,
Not
my daughter is not even with her periods, but it's perfectly all right. Any time from the age of 10.
any time from the age of 10. It doesn't have to be related to the period, or if she started or not started. It doesn't really matter. HPV can be given. All right.
Absolutely.
Yes. Now, next question is Kushnawaz Ansari's question. Should we follow IAP recommendations or universal immunization program for vaccination? Are these different?
See, what is recommended by the government is called UIP, Universal Immunization. What is recommended by the private body is the IAP schedule. The IAP schedule would have a little more vaccines, some of which are pricey and not affordable for a patient going to the government sector. So, if you can afford it, the IAP schedule is perfectly fine. But if you don't want, as a matter of principle, to not give anything more than the UIP, that's fine as well. But at least the UIP, it's good to complete.
Done. Next question is Chaitra Vallishpai. Is there an alternative for MMR and varicella vaccine? My son has egg allergy. It would be helpful if there is an alternative. Allergic to
See,
eggs.
I have had patients who told me after I have given them the vaccine that I have egg allergy. So there's nothing I can do at that point. I asked them to wait for half to 1 hour in the premises after completing
Ma'am,
vaccines. I did not see
ma'am,
major
will you
side
please
effects.
repeat?
So,
Ma'am,
say
will you
again?
please repeat? You had an issue glitch of your voice.
Yeah, no, I said one of my patients told me about his egg allergy only after I had completed the MMR vaccine. So even that child was safe. So it is okay if you have egg allergy to go ahead with MMR and varicella vaccines, even if you have egg
Okay.
allergy.
Even if we have. So there's nothing that they have to take care about it. Yeah,
No.
that's nice. That's very promising. Satish Chaudhary Manne, my son is 9 years, 5 months, and what are the upcoming vaccines for him?
9 year, 5 months, he'll need his 10-year booster for diphtheria, pertussis, and tetanus. I don't think COVID vaccines have yet been recommended for 10 years. I would just go through his vaccination schedule. If there is anything that is not completed, maybe the doctor can advise you. Say, for example, chicken pox. If he's never had chicken pox, maybe he can have 2 doses of chicken pox, 2 to 3 months apart.
Okay. Here's a question which you've already answered, but for the benefit of others who have joined late or again, reiterating is no problem. Ajay Goel and Sushanta Bagh, both of them are asking about vaccines for children. I would want, my child is 3 months old, and I would like to know about how many vaccines would be required for child up to 1 year, because in government and private hospital, the number of vaccines are not the same. And Ajay asks, can you please share the vaccination calendar for the child below the 18 years of age? So just to reiterate the vaccinations again.
Sure. So at birth, the child would have received BCG, oral polio, and hepatitis B. So if he is 1.5 months, we start the other routine vaccinations. At 1.5, 2.5, and 3.5 months, we would give the diphtheria, pertussis, whooping cough, hepatitis B vaccines. We combine it with rotavirus and pneumonia vaccines. At 6 months, he would need typhoid vaccine and flu vaccine, which you would repeat the flu vaccine again at 7 months. At 9 months, he would need MMR vaccine. At 1 year, hepatitis A, which would be repeated at 18 months. And at 15 months, MMR vaccine and a booster for the pneumonia vaccine. At 1.5 years, a DPT booster with brain fever vaccine. So
Okay.
if we can get a person's mail or thing, we can WhatsApp the schedule to him.
Done. Thank you so much, ma'am. And just for the understanding of the viewers, Dr. Shyamala J can be consulted on Apollo 247 app as well. And any personal queries or any other queries other than vaccination or immunization, today we are just taking up these, but any other pediatric consults, you can just consult her on Apollo 24/7 app as well. Ma'am, next question that I want to take up is, ma'am, can a 4-month-old breastfeeding mother take COVID vaccine? This is Nisha Hassan asking the
Yeah, it's
question.
absolutely safe, Jansi. Pregnant and lactating mothers are actually our priority for vaccination. Anytime we know that they've not been vaccinated, we give them an early appointment so that they complete it on time, so that their baby is protected as well.
Done. Next question is, Shailaja, madam, if we have done OPV, oral polio drops today, can a hepatitis A first dose be administered after a week after
Absolutely,
OPV?
there's no problem at all. You don't have to space out vaccinations. You can give it.
Okay. Here's a registered viewer's question, ma'am. My son is 5 months old. He has been vaccinated at a government hospital and private both. So at both places, vaccination chart is very different. He has missed one IPV or OPV, I'm not sure about that, OPV dose, and taken 2 doses of PCV. Is it necessary to take the 3rd dose of PCV?
If 2 doses of PCV have been given 2 months apart, then he needs to take a booster at 15 to 18 months.
Okay. So they need to take a booster after
Yeah.
15 to 18 months. Right.
Yeah.
So again, a question about the difference between the government hospital and private hospitals have come up, ma'am. I've done babies 6, 10, 14 weeks in government hospital. Can we do the booster dose in private hospital? Brand of vaccines in government and private are different. Is that okay?
See, the brands are different, but what the illnesses you want to cover are the same. So probably the pneumonia vaccine and rotavirus vaccine may not be given in the government sector, but these are given in the private sector. And I did mention the difference in the way the injectable polio is given in the government. It's given as a smaller dose and under the skin, whereas in the private sector, it's given intramuscular. So actually, if you see, they are covering all the illnesses both in the private and the government, except these two, rotavirus, which you don't need beyond the age of 6 months, And pneumonia vaccine, maybe you will, if you've already had it, then you just need to complete a booster 15 to 18 months.
Okay. So the brand change does not affect.
Does not matter.
That does not matter. All right. Then Huza is asking next question. Which influenza vaccine should I give my 7-month-old daughter? Are they brands? Kindly suggest one.
See, all flu vaccines are almost have the same level of effectiveness. Brands do not matter, but please give whatever brand you want in consultation with your pediatrician. 2 doses at 1 month interval, starting at the age of 6 months.
Okay. My next question is Covaxin second dose is due to my daughter. Can they take even during periods? Venkat Media.
Yeah, menstruation does not have any impact on vaccination, so she can safely go ahead and take it.
Done. So again, for adults or for teens, menstruation, regular periods are not a hindrance for getting vaccinated. And we need to keep telling this, and we need to keep spreading this awareness over and over again. You must be hearing a lot of this, no, ma'am?
Actually, no. The kind of
Huh?
parents that come to us are already primed, and so if anything, they'll probably ask us about side effects of vaccines, and they don't have to ask us. We tell them straight away. So, I mean, I think all vaccines are safe. So,
No, I
yeah.
have heard between my own friends that they have avoided their period to get their vaccination done. So,
Not at all
even though they
required.
don't discuss, it's not at all
Yeah.
required. So, there
So
is
you
certain amount of hesitancy.
yeah, not
Yeah.
required at all. You're right, Jansi.
Yes. My next question is from a registered user. This is not about immunization or vaccination. This is a general pediatric question because they've already registered. Let me take this opportunity to ask this question. How to prevent multiple UTI for a 6-month-old baby girl having history of hydronephrosis at birth, done PUJ manual operation?
Okay, that's a very complex issue. Maybe we should mail this patient, get his details, and address it, you know, comprehensively. Um I think there may be
Yes.
more issues than he states. So
Yes.
this is a
Yes.
complex issue.
Definitely. Yes, I know these are platforms where certain questions cannot be taken up. Dr. Shyamala can be consulted on Apollo 247 platform, and these are certain cases where she'll be able to guide you in a personal consultation. Thank you, ma'am. Ma'am, next question is regarding a premature baby's vaccination. Vibita is asking this question. What are the precautions that one needs to take care in vaccinating a premature child?
Okay, a premature child is any baby that is born before 36 completed weeks. So it depends on how premature the baby was. And these babies don't get immediately discharged from hospital. So at the time when they are discharged from hospital, if they've crossed the weight of 2 kilos, then the birth vaccines would be completed at discharge. So which will be BCG, hepatitis B, and oral polio. And from then on, if the baby is doing well otherwise with no other major health concerns, they can follow the routine vaccination schedule. But I think prematurity is long time. It could be a baby who's born anywhere from 26 weeks to 36 weeks. So I think a personal discussion with their pediatrician to sort out individual issues. But they have to cross the age of 2 kilos to be able to receive hepatitis B.
Done. Usha's question is, hello ma'am, my daughter is 8-year-old. Any vaccinations to immunity boosting? Are there any immunity boosting vaccinations, ma'am?
All vaccines boost immunity. So, which boosters are needed at 8 years depends on the child's previous vaccination status. So, if there's any vaccine that the child has missed, then that could be updated. And if the child has any tendency to have like frequent respiratory infections or asthma, then she could consider having a flu shot. So immune booster as such, it depends on, as I said, the previous vaccination status of the child.
Done. Siveshan Sharma is asking, my child got MMR at 14 months and hasn't got any other, he's 3-year-old now. Should I give the other dose now?
Yes, please. So this would be a catch-up vaccination. So he should have had a pneumonia booster as well at 15 months, along with the MMR booster. At 18 months, he would have had the pneumonia booster and the DPT, that is diphtheria, pertussis, whooping cough booster, along with the brain fever. So please complete it if you've missed it.
Done. Ma'am, one last question before we wrap up about polio again, because we started it as a Pulse Polio Sunday. Here are questions from Ayub Ghosh, Hamsarekha, and Nityananda. Everybody is asking about Pulse Polio again. How many times is it okay to take oral polio in government sector until 5 years? Please advise female 5-year-old polio drops. So let's conclude with reiterating polio drops.
Okay, so normally the first dose of oral polio is given at birth, and they would give it at 6, 10, and 14 weeks in the government sector, again at 9 months, and then at 1.5 and 5 years. But if you've had the injectable polio, then the number of oral polio doses go down. You have one at birth, and then one at 6 to 9 months, then one at 1.5 years, and one at 5 years. But the pulse polio vaccine is given every year for all children under the age of 5, usually in the month of January and February, 2 doses 6 weeks apart. So that is mandatory for all kids under the age of 5, irrespective of their previous vaccination status.
Done. So Priyanka Chatola, I think your question is answered in the last answer. So thank you so much, Shyamala Garu, for answering these questions for us. It was a great awareness session that you have taken up on this Sunday morning. We appreciate your time. But before we take leave from you, I would want to hear some top tips of how to keep our children safe and how vaccinations will help our children.
Thank you, Jansi and Apollo 24/7 for having me here this Sunday. Just to reiterate, I think vaccination to protect the unborn child is important. So start vaccination before planning pregnancy. So ideally, check the rubella vaccination status of mother planning pregnancy. So if she's not received the rubella vaccine, ideally to have one shot of rubella before pregnancy. And in pregnancy, they can consider having COVID vaccination mandatorily, and also a flu shot in the later part of pregnancy, and DPT vaccines. We call it Tdap shots, 2 shots in pregnancy in the later half. And once the child is born, at birth, we give BCG, polio, oral polio, and hepatitis B. At 6, 10, and 14 weeks, we give diphtheria, pertussis, whooping cough, brain fever, and hepatitis B vaccines. And at 6 months, we give flu shots, 2 doses a month apart. At 9 months, MMR vaccine. At 1 year, hepatitis A vaccine, and a repeat of this is given at 18 months. And a booster of DPT, polio, and whooping cough, along with the brain fever vaccine at 14 months. At 15 months, you will have the MMR and pneumonia booster. And at 5 years, you will have the DPT, whooping cough booster, along with IPV. So these are the compulsory vaccines. There are some optional vaccines. We already mentioned the cervical cancer vaccine for girls above the age of 10. And you can have brain fever vaccines for especially children going abroad, teenagers. I think these complete the vaccine list in in childhood. And every year when the Pulse Polio campaign is advertised, please take your child and complete 2 doses at 6 weeks apart, usually given in January and February. And this is irrespective of your previous vaccination status. I think that kind of completes the mandatory vaccines in childhood. So I hope if there are no more questions, I'm happy to take any questions by mail or WhatsApp. So I'm sure the staff will share my number. So please feel free to post your questions. Thank you.
Thank you, ma'am. Thank you so much. Definitely, we've answered most of the questions, and most of your answers have covered the questions. In case that I could not take up any personal questions, your answers have given them the answer for their query too. So thank you once again, ma'am. More power to you, spreading more awareness and information. Thank you, ma'am.
Yeah, thank you.
So now it's time for you all to answer my questions. I'm going to ask you 3 questions in health quiz. I'm going to ask you the questions here. Please do answer the questions over YouTube chat only. I know people are watching this from various forums, but if you can answer the questions over the YouTube chat, I'll be able to pick up the winners from here. And the winners will be selected by Apollo 24/7 team. And we'll be announcing the winners then towards the end of the show. Once you are declared as a winner, you have to write back to us to claim your gift vouchers. Write us back at marketing@apollo247.com. All right, for the questions, 3 questions for today are on the screen. The first one is, which recent most COVID-19 vaccine was approved by Drugs Controller General of India for children between 12 to 18 years of age? Which recent most COVID-19 vaccine was approved by the Drugs Controller General of India for children between 12 to 18 years of age? Question number 2, which are the 3 common types of microbes? बहुत easy question hai. Which are the 3 common types of microbes that can affect your health? Question number 3, under one tap doctor consult service, in how many minutes can you book an appointment with top Apollo doctors? The answer can be found on your Apollo 247 app under the one tap doctor consult service. How many minutes can you book an appointment with top Apollo doctors? In how many minutes can you book an appointment? बहुत ही easy answer है, because I've been telling this every week. If you are a regular viewer, you would be able to answer this. If you want the answer, then go ahead. Your answer will be in the Apollo 247 app as well. I'm waiting for the answers. Yes, a lot of you have bacteria, virus and fungi. 15 minutes, 1 minute. All right, let's see what the answers are. But here's a Fab offer. बस 2 दिन रहे हैं Fab offer का avail करने के लिए. Flat 25% off on the first 3 online medicine orders. The code that you have to use is FIRST3, FIRST3. And if you pay via Amazon Pay, you can earn up to 500 rupees off as well. And this offer is a Fab offer, which will end in 2 days of time, today and tomorrow. Apollo 24/7 app pe aap ye use kar sakte ho. That is great. And please use this offer before it finishes off. Here are the coupon codes which you can use on Apollo 247 app. You can get 199 rupees off on online consultations with Apollo doctors, and also 20% off on medicine orders. HH247 is the coupon code that you can use on Apollo 247. And the winners for today are Jeel Jain, Isha675 and Bhanu Prakash. Congratulations. Please do write back to us to claim your gift vouchers. Thank you so much, all of you, for joining us on this Sunday morning and asking your questions. And next week, we are going to talk about an interesting subject, women's health and common gynecological issues. So do not wait. If you want to get a reminder, go ahead and subscribe. There's a bell icon there, and you can subscribe to get regular notifications. So next, it's a gynecologist, Apollo expert, Sunday, that is 6th of March, 11 a.m. So that's it for today, folks. Thank you so much for asking your questions on immunization for kids and teens. Next week, we shall meet you with the gynecological issues. Thank you again. Bye-bye.